Scientists from the World Health Organization have arrived in the Chinese city of Wuhan to investigate the origins of the coronavirus pandemic. Now, the international team of experts will first spend 14 days in quarantine before researching how the virus may have moved from animals to humans. Early on, it was traced to this wet market, now shuttered up, where wildlife was sold as food. It suggested that it was here that it made the leap. The delayed trip follows months of diplomatic wrangling. China initially denied entry to the scientists. It argues that the virus may have originated elsewhere. For more, let's bring in Dale Fisher, infectious disease specialist at the National University of Singapore. He's also head of the WHO's Global Outbreak Alert and Response Network. Thank you so much for making the time to speak with us here on DW News. We understand that you were part of the WHO-China joint mission last year. As we've been hearing, another WHO team arrived today in Wuhan. What are they looking for?
Well, they're obviously trying to find the origins of the virus, which is obviously a very complex mission. We chose to not address this a year ago because we prioritized more in terms of the response, understanding the virus, the disease, the interventions that could work. So this is now in a more elective way going to look at this. This will take a little while to get to the bottom of.
And the mission to establish the origins, if we just look at the timeline here, China earlier had kept this initiative out. What sort of challenge has that presented now to finding out how the outbreak really started?
So that's not quite true. It was very much a joint decision that we would, back in February, prioritize the work. And I think if you look at the report that we came out with in February, I think it's literally full of essential information that's been used and has stood the test of time. So in fact, even back then, we were looking at some of the data which China was producing in terms of swabbing of animals and trying to find intermediate hosts. So this is really building on a lot of work that's been done so far. And actually, I'd quite dispute the fact that we're losing anything in the last year. I don't know if you're going to get a lot from looking at a market, even back then. It's really about looking at the data, looking at the PCR results of people, of animals, looking at the environmental swabs, doing all the genotyping. So the mission really is to give it context, if you like. It's important to go there, but actually I think a lot of the work will be done inside and looking at data.
Okay, got it. Tell us a little bit more about what you see happening, in the country right now, because we've had some reports of a spike in infections and lockdowns in several areas of China. What more can you tell us about that and what you might be seeing also in the region more broadly?
Yeah, it's a good point. But actually, China has, if you plot China over the last year, there was obviously that huge effort to bring under control the nationwide spread, which was obviously focused in Wuhan and Hubei, but in fact every province was affected, probably in the triple digits, and that massive nationwide lockdown. But since then they've had several other clusters. Now there are obviously a couple of theories, and everyone will be aware of the theory of importation on fresh and frozen food. The other theory, of course, is could it have just been in a traveller that perhaps had a false negative test on clearing quarantine, sort of thing. So somehow, as we've seen in many countries, it can infiltrate the borders and cause clusters. And China's response has always been very aggressive, as we know. It does lockdowns, it isolates communities, it does mass swabbing in the order of millions of people as an adjunct into the the contact tracing and the quarantining and the serial testing of contacts. So it's China's obviously really learned a harsh lesson from what happened in Wuhan, and even a couple of cases now results in a very dramatic response. So actually what's happening now I don't think is significantly different to what we've seen for the last year in China.
Dale Fisher, chair of the Global Outbreak Alert and Response Network at the WHO. Thank you so much for joining us.
Thanks for having me back.
And elsewhere in the world, Germany has recorded its highest 24-hour death toll in the pandemic so far. The Public Health Agency for Infectious Diseases, the Robert Koch Institute, reported almost 1,250 deaths in a single day. Its president called upon employers to allow more work from home, warning that the new coronavirus variant presented a serious threat.
It is possible that the situation will get worse. That's why it is all the more important that we consistently adhere to the current measures. We must prevent the new COVID-19 variant from spreading. Unnecessary travel should be avoided. All cases of this strain that we're currently aware of in Germany are because of travel.
And meanwhile, the WHO is holding an emergency meeting to discuss the new variant of the coronavirus. There are concerns that the variants may be much more infectious than the first strain that emerged in China and could potentially render some vaccines less effective. Global virus cases now stand at over 90 million, with some 2 million dead. Several countries are experiencing their worst day yet of the pandemic.
At this London hospital, doctors are treating 3 times the usual number of patients in the intensive care unit. They say they are struggling to cope.
There's just so many people to be seen, and as soon as one person leaves, there seems to just be someone comes straight back in. Staff-wise, we're stretched. We're working probably the hardest we're ever going to work in our career.
A sharp increase in serious COVID-19 cases and record deaths come a month after a new variant of the coronavirus was detected in the UK. Many countries have since restricted travel due to the British variant, but it still spread to at least 50 territories, according to the World Health Organization. Other new variants have also been reported, including in South Africa and Brazil. The consequence of an ever-changing virus.
It is inevitable that the virus is evolving, and the more it spreads in an uncontrolled manner in many places across the world, the more chances we're giving the virus to evolve.
Eerily empty streets, again a feature of countries worldwide, as governments extend or ramp up restrictions to try and limit the spread of the virus variants. While authorities say there's no evidence the British and South African variants make the virus more severe, they share a common trait that's believed to make them much more contagious.